Hello everyone, we will start in about 60 seconds, so just hang tight. Okay guys, I want to start off by apologizing. I am under the weather. My kids have been sick off and on for about 5 weeks, and I finally got something, so pardon me if I have a coughing fit or need to take a drink. I'm kind of stopped up. But anyway, so I am Dr. Shannon Clark. I am the founder of Babies After 35. A little bit about me. I am a double board certified OBGYN and maternal fetal medicine specialist. That means that after medical school, I did 4 years of OBGYN residency, followed by 3 additional years of a maternal fetal medicine fellowship to specialize in high-risk pregnancies. That means anything's related to a woman when she's pregnant that makes her high risk, whether it's maternal or fetal or both. I became interested particularly in pregnancy after age 35 due to my own personal history of wanting to start a family. I was very dedicated, obviously, to my career for many years. It ultimately took me 15 years to finish training and then additional years to become double board certified. I met my husband, my future husband, at age 38. We married at 39 in May of 2013. We started trying to get pregnant right away and did have a miscarriage. Shortly thereafter, we continued to try again with no success. I was then diagnosed with melanoma in December of 2013, underwent a surgery, which did cure it, thankfully. But by then I was I just turned 40, and I started to freak out a little bit because I did know about the risk and problems with becoming pregnant after age 35 and especially age 40. So I went straight to a fertility specialist. Based on the statistics after age 40 and the pregnancy rates after age 40, my husband and I did choose to go straight to IVF. After 5 cycles of IVF, we did get several eggs retrieved from those 5 cycles. However, out of all 5 cycles, only 1 embryo was normal, meaning that the chromosomes of only 1 embryo were normal. We did, that took us about almost 2 years to get through those 5 cycles. We did transfer that 1 normal embryo, which did not take. So after being unsuccessful and I was nearing age 42, we decided to go through egg donor, and we did choose an egg donor. She was able to give us 5 normal embryos. We transferred 2 of those normal embryos, and that was unsuccessful. So by that point, I'd had 1 miscarriage and 2 unsuccessful embryo transfers. We then transferred an additional 2 embryos in March of 2016, and we became pregnant. I delivered my boy-girl twins at 31 weeks in September of 2016, and they are happy and healthy and beautiful babies. But, you know, it was a long road, and I did get through it, and I've written about it extensively. So if anybody's ever interested in looking at any of those things that I've published, just please contact me, and I'll send them to you. But that's just a little bit about me. I am a maternal fetal medicine specialist, a professor. I am an educator, researcher, and clinician. And I'm a mom to twins at age 42. They're 3, so it means I'm 46 and soon to be 47. So why am I doing this? I started Babies After 35 to educate, first and foremost, to give women a voice, but to also share my story and be transparent in the hopes of helping other women in a similar situation. I am an academic, which means I do read all the research and the data, so I do rely on that. I do practice evidence-based medicine. So sometimes the statistics are not very favorable for us, especially after we hit age 40. But it's best, in my opinion, for everyone to be informed and know where they stand. So the first thing I want to talk about is, why is 35 such a magic number? Why does that automatically give you the label of advanced maternal age, of being geriatric pregnancy, or elderly multigravida, or elderly primigravida, which all of those terminologies are not very nice to hear, but they are actually ICD-9 and 10 codes that we do use to bill when we see patients over age 35. So they're legitimate codes, like it or not. So why is age 35 the magic number? Initially, age 35 was the magic number because that was the age at which a woman's chance or risk of having a baby with Down syndrome was equal to the risk of having an amniocentesis, which is the invasive test that we use to definitively diagnose Down syndrome while a woman is still pregnant. Amniocentesis is where we take the needle into the uterus, we take off some fluid, we send that fluid for testing. It takes about 2 weeks, and that is the only way when a woman is pregnant to know for sure if a baby has normal chromosomes. That's the first reason why age 35 is a magic number. The other reason is Down syndrome is the important chromosomal abnormality because there is a small percentage of babies that have completely normal ultrasounds, meaning that they have Down syndrome and they have completely normal ultrasounds. So a lot of the other genetic abnormalities, you also hear probably about trisomy 18 and trisomy 13. Those babies, majority of the time, have something abnormal on ultrasound, whereas there's about 5% of babies or so with Down syndrome that have normal ultrasounds. The third reason why 35 is an important number is that although more women that have babies with Down syndrome are younger, that's because they're having more babies. We have a larger proportion or a larger percentage of women that have babies with Down syndrome over age 35. They're having less babies, but more of those babies more of those women do have babies with Down syndrome. So that's the three main reasons why. The other thing we need to talk about is, why does Down syndrome and other chromosomal abnormalities happen as a woman ages? And the reason for that, and everybody knows this, we're born with all the eggs we will ever produce. And every month we ovulate and we lose a few eggs. It's not just one. Usually you ovulate more than one egg. And whether that egg is fertilized or not, those eggs are gone. So by the time you get to age 35 and then 40, the number of eggs that are available to be fertilized have dramatically decreased. That means the ones that are there have been sitting around in our bodies for 35 to 40 years. So the chromosomes get a little sticky, meaning that when they go to split and separate as a pregnancy develops, the chromosomes don't separate the way they're supposed to, and that's when you get the trisomies, like trisomy 21, which is Down syndrome, trisomy 18, trisomy 13. Those are the most popular ones that you hear about when going through genetic counseling if you have over age 35. So that's why we're more predisposed to having babies with chromosomal abnormalities. So that is considered ovarian aging, and then meaning that as far as how many eggs we have available, and the fact that they're older and stickier. So unfortunately, that does not have anything to do with how healthy you are. It just has to do with your age alone. So I was very healthy. I didn't drink, smoke. I exercised. I was of a good weight. I didn't have any chronic medical conditions or anything like that. And I did not have any normal eggs. Well, I just had one that was chromosomally normal. So I had decreased ovarian reserve, which meant that I have no chromosomally normal eggs. That was my reality. Now, that does not mean that women over age 35 and over age 40 cannot get pregnant. Of course they do. I deliver them every day. I deliver many women over age 35 and 40 who have normal babies, but we are still at increased risk. So knowing what our risks are, being educated, and having a plan, talking to your OBGYN about it as you get up to that age about what your plans are for family planning is so important. So I always encourage my younger patients who are not planning on having kids yet to make sure they have these conversations about their future fertility plans with their OBGYN. Another thing I wanted to talk about is that age 35 and above, we are at risk for complications just based on our age alone, no matter how healthy we are. That's just based on age alone, and that's based on the studies that we've done. Women over age 35 are at increased risk for developing diabetes and high blood pressure in pregnancy. We're at increased risk for having multiple gestation, naturally, not through IVF, but just naturally having multiple gestation, because as you get older, you're more likely to ovulate more than one egg. We're also at risk for having a preterm labor and delivery. We are at increased risk for having a low birth weight or a larger baby as well. And also, you probably have heard about this a lot in the media, we are at increased risk for having cesarean section just based on age alone, and that's typically due to labor abnormalities as a woman ages. Then finally, we're at increased risk for having placenta previa. Placenta previa is where the placenta is not placed in the uterus the way it should, and it's actually lower and over the cervix. And then we're also at increased risk for having pregnancy loss. That's related to the fact that we're at increased risk for having a baby with chromosomal abnormalities that may result in a miscarriage. So that's what it means when we're at increased risk for pregnancy loss. I always say that, yes, all these risks are there, and it's very scary, and I get it. I went through it myself. But it doesn't mean that we're necessarily a ticking time bomb. And it doesn't mean that we're automatically going to have those complications. It does mean you're high risk. I hear a lot of women say, I'm 38 and I'm healthy, I shouldn't be considered high risk. Well, it may not be such a bad thing that you are. What that means is that your doctor is assessing you in the context of your age. They are keeping in mind what you're at increased risk for, and they're going to be more vigilant. Now, that doesn't mean they should be vigilant with every pregnancy, but if I have a 39-year-old woman who is pregnant with her first baby, and we're talking about extremes of age there, I'm going to watch a little bit more closely for certain signs that she may be more predisposed to developing as far as diabetes and high blood pressure and the other things. So I don't think it's necessarily a bad thing that we are more vigilant with the women that are over age 35 and especially over age 40. It just means that the doctor should be paying more attention to these things so that we can be aware and ready if a complication could happen. Let's see. So here's a question that just came through. What can I do to help me get pregnant without IVF? I'm 38. I've had the Mirena for 5 years. I have 5 kids already. I had my youngest. So, well, if the Mirena is in, I'll just call you Marie. Marie, if the Mirena is in, obviously you need to take that out just to see what your cycles are on their own. It may take your body a little while to get back into a normal cycle. If you're having normal monthly menstrual periods of a normal duration and timing, you should be ovulating, and give yourself 6 months to a year at age 38 to see if you can get pregnant on your own. If you don't, then you may need to be assessed with further testing. I hope that answers your question. The other thing that you could do to help you get pregnant naturally without IVF is if you have any chronic medical conditions, make sure those are under control. Make sure you're at a healthy weight. Make sure that there's not an issue with your husband. Not every time a woman can't get pregnant doesn't mean it's her fault. There's a large percentage of cases that are due to something that's going on with a man. And having a sperm count or a semen analysis is essential for any infertility workup. That's one of the first things we do, no matter what the age of the woman is having a semen analysis on her partner. So making sure your partner is healthy as well is also just as important to getting pregnant as it is for you to be healthy. So those are some of the, so a healthy weight, what is a healthy weight? So basically we look for a BMI between 22, 25 to 30. That's considered normal weight. Once you get over 30, that is considered overweight. And then once you get of a BMI of 40 or more, then that is considered at the highest risk. BMI is body mass indexed. You can actually Google it, and there's a calculator, and you can put in your height in inches and your weight, and it'll give you what your BMI is. Let's help me get pregnant. Here's another question. I'm not sure what this word is, to help regulate my sugar resistance, which help me get pregnant. I have 5 weeks, 2 days a day. Could I continue to take, or Okay, so if you're, so she, Miss Moon is asking me, she took some kind of medication, the word didn't come out, to help her regulate her sugar resistance. I'm guessing she might have been PCOS. She's now 5 weeks and 2 days. Can I continue to take it or should I stop? So I would continue it until you see your OBGYN, okay, because it's not going to hurt anything, but they may take you off of it. Once you are pregnant, because it depends on whether or not you have a diagnosis of diabetes. So you need to make sure you talk to your OBGYN and as soon as you see your doctor. So I could still have a good chance of still having, yes. At age 38, yes, there's a lot of women at age 38 that have babies. So there's obviously a very good chance that you could still get pregnant and have a normal, healthy pregnancy at age 38, consider it, especially if you're taking care of yourself and don't have any uncontrolled chronic medical conditions, you're at a healthy weight and things like that. So there's always a chance, yes, that you could have a healthy pregnancy. Okay. I'll keep looking for questions to come in as we roll through, but I'll just keep talking until I get a question. So the other things where I was talking about is, is there increased risk for complications of pregnancy? So yes, what I was talking about before is that I hear so many women, they actually get offended when they're considered high risk because of their age. I kind of get it, but then again, I didn't mind having the extra care. And I was kind of happy that someone was taking that extra, we're getting a lot of questions here. Okay, I'm going to stop. Another question from Cynthia. I'm 41 and about to start trying for your first baby. How long should I wait before seeking medical assistance? Cynthia, no more than 6 months. There's some thought that 3 months, but if you are you got to think about where you're starting from. If you're already starting with normal cycles, menstrual cycles mean a lot, and it can tell you a lot about your fertility potential. If you're having regular, normal, monthly menstrual cycles of normal duration, then there is a chance that you're ovulating. If you're not, then that's a problem to begin with. If you're not having a period every month, or they're a hit or miss, or if you're spotting in between, then there's something going on. So if you're 41 with normal menstrual cycles, I would wait no more than 3 to 6 months before seeking assistance. I hope that answers your question. The next question is, I had a very traumatic miscarriage at 38, and I'm now almost 40. I hemorrhaged. Would you recommend try again or not? Would I recommend? So a lot of women have miscarriages, and a lot of women hemorrhage with miscarriage. I've taken care of many of those women myself. It sounds like if you had a lot of trauma with it, it may be the trauma that's the issue and not necessarily your ability. You have to decide if you're mentally and emotionally prepared to try again. Just because you had a miscarriage and a traumatic miscarriage and hemorrhaging and all that doesn't mean that you're going to have it again. There's always that risk with any pregnancy, not just a woman over age 40 or over age 35. A lot of women go through this. 20-year-olds go through it. I've seen it. 40-year-olds go through it. I've seen it. So if you want another baby and you're almost 40, then you need to decide with your family or your partner if you guys are willing to try again despite what happened before, because it will be scary for you, and I totally get that. Okay, so she was saying she was 12 weeks. Amanda was saying she was 12 weeks when she had the miscarriage. Yeah, miscarriage is traumatic no matter what the age it happens or gestational age. It's just as traumatic at 12 weeks as it is sometimes when it's close to term. Every woman handles pregnancy loss differently. So you just have to determine if you're willing, if you think you're emotionally ready for that. But if you're wanting to have another child and you're close to 40, I wouldn't put it off much longer, because you're getting to that age to where it maybe start becoming more difficult for you to get pregnant naturally. Okay, I hope that answered your question, Amanda. Okay, let's see. So, we talked about the complications and not being necessarily, don't get offended if you're considered high risk. I kind of got offended that I was called elderly or, geriatric, but whatever. I dealt with it. It's just a label and it's fine. We haven't come up with better ways to, signify what a pregnancy is over age 35. Hopefully one day that will happen. Okay, next thing I want to talk about. So, can women over age 35 and over age 40 have normal pregnancies? The answer is yes, they can. Are they at increased risk? Yes. Should they be watched more closely? Yes. Is it going to be a complicated pregnancy? No, it doesn't have to be. I see and deliver many women over age 35 and, like I said before, and over age 40 who have completely healthy, normal pregnancies. Okay, Summer is asking, I'm 39 and not in a relationship and plan on using a donor and the Mosey baby kit. What are the odds of this working for me? I have been normal. I'm sorry, Summer, if you could just type it. I don't know what the Mosey baby kit is, but if you're saying that you're 39 and you're not in a relationship, but you're using a sperm donor, you have normal cycles, and you say you're ovulating, I say the chances are pretty good. Now, that still doesn't take away the risk that comes with being age 39 and as far as pregnancy loss and the other things we talked about earlier. But the chances, I'm assuming as long as you're otherwise healthy, it should be fine. But I am curious to know what that Mosey baby kit is. I'm going to have to look at that because I have not seen that before. But if you're ready to try. I always encourage women over age 35, even if they don't have a partner. I've been through it, and I know how much I had to go through to get pregnant, and I had a partner. So I never ever tell a woman over age 35 or 40 if they don't have a partner to just wait for a partner. No, if you're ready and you want to do this on your own and you have what you need to get through this pregnancy, then do it. Okay. So we'll go back to an otherwise healthy post. If you're otherwise healthy, you can have a normal pregnancy. It's important in general to be in the optimal health as you can. If you are over age 35 and especially over age 40 and you have chronic medical conditions, especially if they're not controlled, I do always recommend that you see a maternal fetal medicine specialist for preconceptional counseling. That means you see the specialist before you get pregnant. So we could try to get those medical conditions under control, or we could tell you what the potential additional complications might be. The time to get a medical condition under control is not once you're pregnant. And I see that all the time because women are have uncontrolled high blood pressure, uncontrolled lupus, uncontrolled kidney disease, uncontrolled diabetes, and then they get pregnant, and now we're playing catch up. If at all possible, if you have these conditions and you're wanting to get pregnant, try to get them controlled first. And you can always do what's called a preconceptional counseling visit with a maternal fetal medicine specialist so that we can assess you and let you know what we need to do to get you ready for pregnancy. That's always a possibility. And insurance, as far as I know, all insurances will cover that type of visit. So if there's any question about whether or not your insurance will cover that type of visit, you could always call your insurance company and find out, or just ask your OBGYN or whoever's doing your women's health care maintenance. Okay, so another little thing I like to do is fertility and pregnancy after 35 factor fiction. So in just a second, we'll take a drink. Okay, so factor fiction. The first thing is, a woman is born with all the eggs she will ever have in her lifetime. I already touched on this. The answer is yes. The female is born with 1 to 2 million eggs. At puberty, she then goes down. It then goes down to 300 to 500,000 eggs, and by age 37, 25,000, and age 51, 1,000 eggs left. So the eggs do decrease over time. That's a decrease in egg quantity. And I didn't mention this terminology specifically, you have a decrease in egg quantity, which is the number of eggs, and quality as you age, which means how normal they are chromosomally and where the chromosomes get sticky. So that's the difference between egg quality and quantity. So let's see. Most women by mid to late 40s are no longer able to become pregnant naturally. Although while a woman's eggs have an expiration date, meaning that our eggs do have an expiration date and it's different for every woman, our uterus, which is where we carry the baby, does not. So that's why you hear a lot of women who have IVF in their late 50s getting pregnant, because the uterus could still carry a baby. They get all the hormones through IVF for the uterus to support the baby. So that's how they're able to actually get pregnant, even though they may not be using their own eggs. For example, I didn't use my own eggs. I had an egg donor, but I carried my babies in my own uterus. So the uterus does not have the expiration date, if you will, like our eggs do. Next question that isn't so bad. I can easily get pregnant at 40. It only takes one. Yes, you're right. It only takes one. However, as we discussed, the egg quantity, which is the number of eggs we have, and the egg quality, which is the number that are genetically normal, decreases as a woman ages, and that starts to accelerate around age 35 to 37, then drastically accelerates at age 40. So yes, it only takes one, but it doesn't necessarily mean that it's going to be easy to do at age 40. I'm a prime example. It was not easy for me after age 40 to get pregnant on my own. Let's see here. Hi, Jennifer. This is a question from Jennifer. If you don't ovulate when taking the birth control pill, do you then have more those eggs? No. So just because you're on the pill and not ovulating does not mean that you get to save those eggs or those eggs are banked. That's not how it works. So if you don't ovulate with the birth control pill, the egg just stays in the ovary and it ages, or it just kind of gets resorbed. So that doesn't mean, I was on birth control pills for almost 20 years before I tried to get pregnant. It didn't give me a bunch of extra eggs once I decided to get pregnant. So that has no effect on your ability to get pregnant or make it easier once you come off the birth control pill. Unfortunately, I wish the answer was yes, but that's not the answer. I hope that answers your question, Jennifer. Okay, let's see. More and more women are delaying childbearing. I am 28. I don't have to worry about my fertility anytime soon. That is what I call a combination of fact and fiction. The fact is women are delaying childbearing for multiple reasons. Some are starting over after divorce and having that second family with a new partner later in life. Also, societal perceptions are changing, and women are not expected to marry early and start a family in their 20s. Women are pursuing careers, waiting for financial security, traveling the world, living their lives, and many want to experience life and before starting a family. And also, more and more women are turning to assisted reproductive technology to get pregnant. So that part is true. The false part of that statement is that due to decreasing egg quality and quantity, which I've talked about multiple times, women should have a conversation with their women's healthcare provider if they think that they're going to be delaying childbearing for any reason. Meaning that if you are younger and you think that you're going to anticipate delaying childbearing after age 35 and especially after age 40, you need to make sure you're talking to your OBGYN and maybe even see a reproductive and endocrinology and fertility specialist. That's an REI or a fertility doctor, just to let them know what your plan is, and maybe they can do an AMH on you to assess your ovarian reserve. So my piece of advice is, yes, live your life, do what you need to do. But if you are anticipating delaying childbearing after age 35 or especially after age 40, you need to assess your fertility. Leah's asking, she's pregnant at 39 and she has a cold. Can she take anything? Yes, Leah, you can. Actually, every doctor's office should have a list of safe medications to take. You could take a saline nasal spray, Tylenol. You could take Sudafed if you do not have high blood pressure issues. You could take cough suppressant as long as it doesn't have the DM in it. Dextromethorphan, no DM. You could take other things. Okay, so Melissa's asking if she should try for baby number 2 at 45. So, Melissa, that's completely up to you and your family. I'm not sure. Oh, okay, all the questions are good. So we'll go back to Melissa. It depends on, if you're, what your situation is. Obviously, we've just talked about how much harder it is to get pregnant in your mid to late 40s naturally. So you may want to see what your fertility or your ovarian reserve is by getting an AMH with the fertility doctor just to get some baseline labs. And also depends on whether or not you're having normal menstrual cycles as well, what your health status is. All the things should be considered before deciding whether or not you want to start for baby number 2. Okay, let's see, Jennifer. I'm 39. I recently had a miscarriage at 9 weeks. I had one child and had a 34 a perfect. Well, how long ago? Okay. I'm 39 and had a miscarriage at 9 weeks. So I'm not sure how long ago the miscarriage was, Jennifer. But as long as what I typically tell my patients, have one normal menstrual cycle and then try again. It's not like you have to wait 6 months or a year. As long as you have, just so you can have that normal menstrual cycle to have your basis for if you get pregnant again. So I just tell my patients after a miscarriage, wait till one normal menstrual cycle and then try again. Okay. Megan is dealing with morning sickness and constipation. So let's talk about constipation because that's kind of something nobody wants to talk about, but I'm glad Megan brought it up. Yes, women who are pregnant get constipated. There's no question. A lot of times it's from the iron pills if you're taking extra iron pills, and sometimes it's from the prenatal vitamins. You can take Colace, which is over the counter, 100 milligrams twice a day. It's safe, and you could try some of the stool softeners that you could put in your drinks, but I always just tell my patients to take Colace. You could also talk to your OBGYN to see if they have a medication they prefer that their patients take. So discuss it with your doctor, but Colace is something that's simple and easy to take. Morning sickness. I don't know how far along you are, Megan, but there are a lot of things that you could take for morning sickness, a lot of dietary modifications. If you look on my website, babiesafter35.com, there's actually a really nice blog on morning sickness under the pregnancy category, and it tells you a lot about what you could do to deal with morning sickness. Let's see, Courtney. How does an underactive thyroid affect fertility, and what is the optimal level of TSH when trying to conceive? This is the only thing that I've been on Synthroid. Okay. So basically, Courtney has hypothyroidism, which can affect fertility for sure. It depends on what she's on Synthroid, which is a common medication to be on. I've been on it for a month or so. So you got to make sure what's more important than the TSH actually is your free T3 and your free T4 levels, Courtney. Make sure that they're following those to make sure they're in a high normal range. High normal, not above normal, but high normal. There's going to be a range depending on the lab of what a normal free T4 is and a free T3. Free T4 is more important, actually a little more important. Make sure your free T4 is at a high normal range or getting close to that high normal range. And it should, if they think that's what's causing your infertility, it should help. But just make sure that they've done the full workup, Courtney. Let's see. Jennifer is 8 weeks ago just having a first. Oh, this is the one. Yes, so you were asking about trying again. So yeah, if you're just having your first normal menstrual cycle, then try again. Absolutely. And then Leah is 14 weeks. Okay. I'll stay on. I was only going to do this from 2 to 2:30, but since we, excuse me, have people answering questions, I'll stay on for another few minutes. Okay, Cynthia. I have 2 small fibroids, one 2 centimeter and the other 4 centimeter. I have to before trying to get pregnant for the first time. Okay. Cynthia, can you tell me how old you are? And Cynthia, for your fibroids. Cynthia says she has 2 small fibroids, one 2 centimeter, which is really small, and 4 centimeters, which is small to medium size. Do you recommend I remove them before trying to get pregnant for the first time, or should I just leave them? It depends on where they are. You have submucosal, which means it could be underneath the lining of the uterus. If it's underneath the lining of the uterus, that can affect implantation. If they're intramural, meaning that they are within the, where did you go, Cynthia? If they're in the wall of the uterus, it probably won't affect anything. If they're subserosal, that means it's on the outside of the uterus, it probably won't affect anything. So you need to know where they are. If they are underneath the lining of your uterus, then you may want to consider taking those out. You need to talk to your OBGYN or go to somebody who knows, who is really good about taking those out, because it's very important that they're doing a good job to take those out, Cynthia. Courtney, okay. Kita, 39, had a chemical pregnancy last cycle, period started on schedule. Should I be worried about Kita, any time a woman experiences a loss, pregnancy loss, and a chemical pregnancy is a pregnancy loss. I had a chemical pregnancy, and it was a loss to me. You're going to worry. You can't help but not worry. It's in our nature as women to worry. This is our bodies. We want it to work. So I could tell you not to worry, but you're going to worry. Okay. My advice to you is to try to talk to somebody, talk it through, keep your stress level down as much as possible, but be hopeful and be optimistic. That's the best thing you can do. But I'm not going to tell you not to worry, because I would worry too. So I get it. It's going to be scary, but just try to keep it in check with the next time you try, so that you don't stress yourself out too much. I hope that helps. AB says thank you. Thank you, AB. Cynthia, you're 41. So hey, Cynthia, you're the one with the fibroids. So listen, again, you need to know where those fibroids are located, and before determining on whether or not you need to take. You're 41. If you're wanting to get pregnant, it's time to start trying. If you know those fibroids are there, if they're under the lining of your uterus, you may want to get them out before you try. But talk to somebody that knows what they're doing when it comes to fibroids and how to take them out, because you have not had a baby before and you want to make sure you're with a good doctor. Okay. Any other questions? I'll stay on for a few more minutes. I really appreciate, this is my first Facebook Live that I've ever done. I hope that I didn't talk too fast. I hope that you guys enjoyed this. I really appreciate you spending the time with me. I'm going to plan on trying to do this at least every week. So if anybody has any special topics they want to address, you can message me on Facebook, Instagram. You can email me at info@babiesafter35.com. Please go to my website and check it out. I'm doing some upgrades. So if you have any suggestions on some things that I could do to improve my website experience, I'd love to hear from you. I am a full-time doctor, very busy. I take a lot of calls. So everything I've done, I've never made money off of Babies After 35. That's not my goal. My goal is to continue providing the information and doing what I can to help you guys. So I hope that you guys give me input and some feedback so I can make things better for you guys. Okay, so someone just asked me, what if you get pregnant on methotrexate? So listen, that's obviously not a good situation. I don't know the rest of your story. If this has happened to you, make sure you talk to your OBGYN about what happened. That's not something I can really talk about here because I don't know your story, Kara. So yeah, that it's not obviously not ideal to get pregnant on methotrexate, but if that has happened to you, make sure you talk to your OBGYN to get more information. Okay, I think that's it. I'm going to close up shop. I am going to do my best to finish this video and save it. I'm going to post it on Facebook, and I'll put it on Instagram Live as well so people can watch this after the fact. And I'll put it on my website too. Again, I want to thank you guys so much. I hope this helped you guys, and I really, really appreciate you spending time with me. I hope you guys got something out of this, and please let me know if you guys want to discuss anything in the future. But I'm going to plan on doing this again next week. I actually have a few other Instagram and Facebook Lives coming up. One is going to be with one of my colleagues who is a chiropractor and does acupuncture for infertility. I'll be sending that information out. I actually did acupuncture when I was trying to get pregnant, and I did that before I had my successful twins. Leah, my Instagram, Babies After 35, everything. All my social media, Instagram, Facebook, Twitter, website, Babies After 35. I've got the market on it. Anyway, so yes, Care. So if you have had methotrexate recently, there is a washout period that is recommended before you try to get pregnant. You need to talk to your OBGYN to ask them, because I don't know when you had it, but you need to wait a little bit before you try to get pregnant again. It's not too long though, okay? Just make sure you talk to your OBGYN. Thank you guys. I'll talk to you soon. Bye-bye.